So axial spine pain, all that term means is you have pain in your neck and or low back that doesn't radiate, typically caused from arthritic changes in the spine that we all have as we age. We had nothing to offer patients for this for decades, and in the last 20 years we've developed a technique called radiofrequency ablation. And all that term describes is we are able to ablate or stop the functioning of nerves that supply the joints of our spine. And the reason we do this in the spine instead of just doing let's say a joint injection into somebody's knee, is the joints of our spine are very small, very, very small. And after the age of 40 or so, they get very arthritic and they're tough to get a needle into. And even if you could, to get any kind of fluid in there is almost impossible. So what we focus on now is the nerve to the joints. And so what we do to find out if somebody has this type of pain coming from the arthritis is we have them come in and we block the nerve first. All we're doing is putting a long-acting local anesthetic around that nerve and seeing how the patient does for the next several hours. And then we call them the next day and find out how they did. And if they had a 50% or greater reduction in their pain, then we know a lot of their pain is coming from the arthritic changes of their spine. And so once we do that, we do that twice to ensure that this is where the pain is coming from. Then we bring the patient back in and we place the needles into the area where those nerves are, and we apply radio frequency. And all that does is heat the area up and create a scar. And so what happens is that once that scar takes hold, that nerve is non-functional for a year or more. I've been doing this for about 20 years, and I would say most people that have to have repeats, it's usually 2 or 3 years before we have to do a repeat, but we could do a repeat within 1 year if we have to, and we've done that over time. So my patients have really benefited from this particular procedure for that axial back pain, that non-radiating back or neck pain.